Hi, this is Dave Kettlewell, and welcome to Medical Matters, because life matters. We will be talking today about what many experts feel is the #1 health problem in America. Can you guess? Cigarette smoking. We'll be back in just a moment. Hang on to your seats, folks. You're going to learn some things today that are going to blow your mind, such as experts now calculate that the cost to the average household in America for people smoking in this country, $1,200 per household. Unbelievable. That's the cost to the American public. $1,200 per household is the health-related costs from cigarette smoking. We have some experts here today, and I do want to introduce you. First of all, we have Tony Billoni, and you're with the Erie Niagara Tobacco Coalition. Great to have you with us. We also have Paula Celestino, your program director for the New York State Smoking Quit Line, which is a way to help people, and we're going to be learning more about that. Welcome to the show.
Thank you.
And Brian King, you're a research affiliate. Correct. Well, I guess that we want to start this off, and let's just talk about cigarette smoking in general. We have about 22% of the American public at the present time is still smoking cigarettes. They pay about $2,200 a year to buy their cigarettes, but the health-related costs to this country are astronomical. It's about $1,200 per household, or what we all pay, because of the damage done to America's health by cigarette smoking. It is calculated that 1/3 of the cancers in America, fully 1/3, would be eliminated by stopping smoking in the United States. And, of course, we know things like respiratory therapists say that 95% of the patients they treat are cigarette smokers. So we're allowing the sale and distribution of a product in America that is, without exaggeration, destroying public health. Your organizations are trying to do something about it. Tony, tell us a little bit about what you do.
We are working at a statewide level in New York State, and the good news in New York State is that our smoking rates are lower than the national average. We're somewhere in the 18% area, so the programs we're working on seem to be having an effect. Most specifically, one thing that has been studied and found to have direct, immediate results is raising the price of cigarettes. And recently, in early June, New York State once again became the state tax leader in cigarettes. So now it costs more than $6 to buy a pack of cigarettes in New York State, even more in New York City. And we found immediately numbers of smokers calling our New York State Quit line the days leading after the tax went into effect. Other things that we try and do at the coalition.
So financial disincentives work.
It's a direct correlate.
To encourage people to seek a solution to their addiction. And of course, it is worth mentioning that we have to recognize that people who smoke cigarettes are addicted to a drug, and a drug that's been spiked by the tobacco companies to be even more addictive. There's chemicals in there to increase the addictive properties. It's a very peculiar product that's allowed to be sold without FDA oversight in the United States at the present time.
Researchers have clarified cigarettes as possibly the most perfectly engineered drug delivery device ever. And it comes from years and years of R&D at the various tobacco companies, millions and millions of dollars spent to do just what you said, to deliver the perfect amount of nicotine to keep someone addicted.
When we talk about smoker rights and health care rights of the public, it's pretty well a given right now in America that adults aren't really being allowed to smoke in many states now. You can't smoke in a school, can't smoke in a government office, can't smoke in a restaurant. We've protected people from secondhand smoke, which is approximately half as damaging to your health as being the smoker themselves. But children in homes, they're exposed to cigarette smoke. They don't have the political strength or the power to stop it. Do you think that's the next frontier in rights in America for smokers, will be to preclude the ability of a parent to expose their child to cigarette smoke?
We've had discussions about that. Maybe Brian has some research that's been discussed.
Yes, there's initiatives that have already been initiated all over the country, and it's beginning in cars, it's beginning in homes. California recently adopted a new policy where they restricted smoking in cars where children under the age of 18 are present. So it's not necessarily a new phenomenon restricting in the personal living space. And with the implementation of public policies, especially here in New York, that's the next frontier, is the private sector, because that's the primary source of exposure for many people. And not all Americans are protected by policies. Only about 35% of Americans are currently protected by a comprehensive policy banning smoking in all work sites, including bars and restaurants.
So we still have a long way to go.
We still have a long way to go.
Right. In the work that you're doing today, which are the frontiers you feel are the most needed and the most helpful to the American public and to the Buffalo community?
We're working in a number of areas to build on the Clean Indoor Air Act, which just celebrated its 5th anniversary, and that act took the ability to smoke out of most public places. So areas that we've been working in and have some success in is hospital campuses. Roswell Park Cancer Institute, which is located in Buffalo, leading cancer researcher in the U.S., has led the way in 2006 to become a smoke-free campus, indoor and out. We have about a dozen hospitals in Erie and Niagara County that have followed that. It stands to reason. It's a hospital. It should be a healthy place. You shouldn't be exposed or help smokers continue their habit. So other places that we've been working in and having growth is college campuses. The governor just signed into law that all dormitories are now smoke-free. To continue that effort, we're making outdoor areas on all campuses smoke-free. So we offer the opportunity of information, support, marketing support, public relations support to these organizations, and also giving them some technical information. Is it legal what they're doing? Are they infringing on people's personal rights? So we have done that sort of research. We come in with that information and help them do it. Smoke-free housing, smoke-free apartments is another area that's very important to us.
You know, one thing I don't understand is that looking at the cigarette smokers as a victim of a product that was designed to turn them into an addict, at the present time, I understand that it is legal for an employer to deny employment to an individual on the basis that they're a cigarette smoker. At least in Ohio, I believe that that's the case. If tobacco is an addiction, and the companies lied about the fact that it was addictive for many of those who are using the drug, what do you think the logic is that would exist to preclude someone's employment because they're a smoker, when, as an example, if they have any other medical condition or addiction, that would not be necessarily a cause to keep them from being employed if they're in treatment?
It's a good question. Is someone?
I don't know. It is a good question, and a pretty complicated one too. But you know, I think we have to be careful with laws that I think frame the smoker as the perpetrator.
Tobacco settlements that were signed. Basically what they learned, as I understand it, was that the heads of the tobacco companies gave false testimony many times in front of the Congress and other investigative bodies that were federal about the dangers of health smoking. They withheld the truth from the American public, none of which were charged with a felony or did any jail time, to my knowledge, which I don't understand that, since those were repeated felonies against the public good. But the part that really surprises me also is that these penalties that are being given by the tobacco companies, those monies really come from the people who are addicted to the drug, and that hardly seems fair to me as well, especially when we consider that a lot of the monies that are generated are going into general operating budgets of the states.
For more Medical Matters television shows, go online to medicalmatters.tv.